In the name of Allah, who is the most beneficent and the most merciful. Today we will discuss about the dengue syndrome. My name is Dr. Fakhar Hayat. You are watching our YouTube channel Medicos Fever. In this lecture, we will discuss about the dengue. Mainly, we are discussing about the background of the dengue. Mainly, dengue is transmitted by a bite of mosquito infected with one or the four dengue virus serotypes. There are the four serotypes of the dengue virus or the flavivirus. Mainly, dengue virus is the flavivirus and it has mainly four serotypes. In recent years, dengue has been transmitted increased in urban and the semi-urban areas. And the most important is the dengue is not transmitted directly from person to person. Mainly, it is transmitted by the vector, which is the Aedes aegypti. Mainly, symptom ranges from the mild fever to the incapacitating high fever. The other is the global burden. In case half of the world population is now at the risk point, and 390 million cases of the dengue virus per year are reported, and risk of infection is the 129 countries and 70% is the burden in Asia. What is the WHO response? WHO means the World Health Organization, which mainly supports the countries in the confirmation of the outbreaks through collaborating network with the laboratories. And the most important is the technical support. They send the staff and they provide the kits and anything else which is required for the outbreaks. They support. WHO main reason is the supporting system. World Health Organization mainly supports. Other is the supports countries to improve the reporting system and capture the true burden of the disease, and mainly formulate evidence-based strategies and the policies. And the main important is the dengue preventions of the dengue and control strategies in adopting the global vector control response, which is from 217 to 213. The reviews the development of the new tools, including insecticide products and the application technologies. This is not so much important, but manifestation of the dengue fever, which is the most important. Dengue fever infection may be sometimes asymptomatic. Person is asymptomatic. There are no symptom appears. Some cases symptoms appear with the undifferentiated fever. This is the undifferentiated fever with the viral syndrome. Sometimes dengue fever with hemorrhagic. There is the bleeding. Patient presents with bleeding, and sometimes they do not present with bleeding. And other is the dengue hemorrhagic fever with the plasma leakage. Sometimes with the present with bleeding, but if there is a case of the plasma leakage, the blood in the blood vessels decreases. There is the effective circulatory volume decreases and systolic pressure decreases. In case of the systolic pressure decreases, that can lead to the shock. Here, dengue hemorrhagic fever with the shock syndrome. Main is the epidemiological determinants. What are three epidemiological determinants? It can be agent factors, host factor, and the environmental factors. Agent may be of the one of the agent is the flavivirus. I have discussed later on the mainly flavivirus has four serotypes. The dengue virus or the flavivirus has four serotypes: 1, 2, and 3 and 4. But vector which mainly transmitted the disease is the two vectors, which is the highly recommended is the Aedes aegypti, which is the most important, and other is the Aedes albopictus. Aedes aegypti, mainly this is the Aedes aegypti. This is the mosquito. Vector is the mainly mosquito, mainly transmitted through the vector. Other is the host. Host is the mainly is the person. All ages at the both genders are at a risk. Man and a woman, children, neonates, all are at a risk. Other is the high risk population with the more severe disease and complication. In case of the infants and elderly, obesity, pregnancy, sometimes peptic ulcer disease, or the women who are in the menstruation or have abnormal bleeding, hemolytic diseases such as the G6PD, thalassemia, and other hemoglobinopathies. Chronic disease such as the diabetes mellitus, hypertension, asthma, and other is the ischemic heart disease, IHD, chronic renal failure, and the liver cirrhosis. These are the mainly causes the complication and the severity of the diseases. Other is the environment. Environment in which Aedes aegypti lives. Mainly, Aedes aegypti fluctuates with the rainfall and the water storage. Its lifespan is mainly influenced by the temperature and the humidity and survives best between the range of the 16 degrees centigrade to the 30 degrees centigrade and relative humidity of the 60 to 80%. It breeds in the containers in and around the houses, mainly endophagic and the endophilic. Most important is the I want to discuss with you is the failure of the urban authorities to provide the civil amenities and the poor public health infrastructure raises the potential for the vector to breed high level and makes the environment transmission conductive. Urban area, mainly due to the lack of the mainly preventions, urban and rural both are involved in the epidemiology of the dengue fever. Mode of transmission, mainly the bite of the infective mosquito, principally Aedes aegypti. This is a day biting species with increased biting activity for 2 hours after sunrise and several hours before sunset. They mainly bite at the dawn and the dusk, in the morning, in the late evening. And dengue outbreaks have been attributed Aedes albopictus, which is not so much important. But the most important, I will be discussing with you the incubation period from 3 to 14 days and period of communicability. Mainly, they are not transmitted from person to person. They are mainly transmitted by the mosquito bite. If a mosquito is ineffective, it remains the whole of life. Mosquito means effective in the whole of its life. And susceptibility to the patient and dengue in the community. Mainly dengue in the community is the initiation and maintenance of the epidemic include the strain of the virus, which is the serotype 1, 2, 3, 4, and influenced by the magnitude and the duration of viremia in the humans. In the human in which they are living in the human and the density and the behavior with the vectorial capacity. Vectorial capacity is the most important. Vectorial capacity means the bite of the mosquito. Here I will discuss with the total number of potentially infectious bite that would eventually arise from all mosquito bite, a single perfectly infectious. Mainly, the most important probable diagnosis is the acute febrile illness. It may be due to sometime fever with 2 or more of the following. If 2 or more of the following present and there is a outbreak of the dengue, we may suspect the patient of the dengue fever. Headache, which is the most important. Retroorbital pain. This is the orbit of the eye and behind it is the retroorbital. Patient present with the complaint of the pain behind the eye. Special complaint behind the eye is the retroorbital pain. Other is the myalgia. Myalgia means the pain in the muscles pain. Arthralgia, pain in the joints and the rash with the hemorrhagic manifestation. Confirmed diagnosis. Confirmed diagnosis may be due to the serum and the CBC, sometimes CBC, and with the mainly serum IgG by the 4 or greater time increase or the IgM antibody for the dengue virus. And other is the ELISA or the immunohistochemistry ELISA test antigen. If antigen is predicted, then it is a confirmed diagnosis of the dengue fever. This is the third. Detection of the dengue virus or the antigen in the tissue, there is a maybe suspected patient of the dengue fever. And the mainly confirmed diagnosis of the dengue fever. Mainly the dengue hemorrhagic fever, mainly it is a dengue fever with hemorrhagic, means patient presents with the complaint of bleeding. It may be internal bleeding, it may be external bleeding. Abdominal pain or tenderness, persistent vomiting, clinical fluid accumulation, mucosal bleeding, lethargy, restlessness, liver enlargement. Other is the dengue shock syndrome. In case of the dengue shock syndrome, there is mainly increase in the leakage of the plasma from the blood vessels. If it is a blood vessels and there is a leakage of the blood, this is called as the, and decreases the effective circulatory volume of the blood and it can lead to the dengue shock syndrome. severe bleeding as evaluated by the clinicians. This is the mainly not so much important. Grading of the severity of the dengue hemorrhagic fever. Grade 1. In case of the grade 1, patient is with the fever and the positive tourniquet test. Tourniquet is the mainly applicable here. There is a tourniquet, and if it is a tourniquet is removed, there is mainly petechiae formations of the petechiae, and it is the grade 1. With the grade 2, it is mainly grade 1 with the spontaneous bleeding, grade 3 with the circulatory failure and the narrowing of the pulse pressure, and mainly 20 millimeter of Hg. Grade 4 with the profound shock with the undetectable blood pressure and the pulse, and patient can lead to the death. Laboratory diagnosis: thrombocytopenia, because platelet count decreases and less than the 1 lakh millimeter or less. And nucleic acid amplification test, detection of the viral RNA, ELISA test. Specific treatment: if patient present with the shock, mainly the hypovolemic shock, there is a mainly provide the fluid and the mainly replacement of the rapid replacement of the fluid and the electrolyte solution, mainly the lactate ringer solution. It is commonly used in the emergencies, lactate ringer solution or the physiological saline. And rate of fluid administration must be judged by the estimate of loss. If there is a great loss of the blood through the internal or external bleeding, we have to maintain the rate of the fluid administration. And the use of the heparin to manage the clinically significant hemorrhage occurring in the presence of the well domesticated. And the fresh plasma may be given, but aspirin is contraindicated. Why aspirin is contraindicated? Patient has also a complaint with the decrease in the platelet count. If we are giving the aspirin, there is also decrease in the platelet count, and that patient can lead to the death. That's why aspirin is contraindicated. Control and the prevention: preventing mosquito by the preventing mosquito from accessing egg-laying habits, and the environmental management and modification, disposing of the solid waste properly, and removing artificial man-made habits that can hold the water, covering and emptying and cleaning of the domestic water storage and container on the weekly basis, that we all discuss, and personal protection from the mosquito bite, and mainly it is the community. Immunization. The last important is the immunization. In mainly the developed countries, the live attenuated dengue vaccine CYD-TDY is more effective. This is called as the dengue vaccine, and efficacious and safe in person who had a previous dengue viral infection, and indication person living in the endemic areas ranging from 9 to 45 years. The preferable patients are the persons is the endemic areas and the ranging from 9 to 45 years of age, and at least one documented dengue virus infected previously. That is the immunization, and we have discussed all about the dengue virus. In the compiling, I will discuss with you this is the most important dengue virus. Dengue virus has mainly its 4 serotypes. That is the flavivirus, and it has mainly the agent it holds, its vectors, which is the most important. This is the epidemiological determinants are the most important: agent, host, and the environmental factors. And that's why it's to be the background. It is transmitted by the bite of mosquito infected with one or the 4 dengue virus serotypes. This is the flavivirus. That we all discussed about the dengue virus. Thank you so much. Jazakallah. Allah Hafiz. Please like and subscribe our channel Medicos Fever, and remember us in your prayers.